Okay, so for the main hip flexors that tend to get us, your psoas comes in through here from your abdomen. Your iliacus comes in from the curve of your pelvis, and they both insert around here. The other thing that you have is your rectus femoris that originates from that hip bone, but your inner thigh actually has a flexor head to it. So you have all these flexors that cross about this area that you need to release or work on. Now, the tool, the hated tool, I could get my inner thigh and dig in here. You can use your fingers, they will fatigue. It's gonna feel a bit like ripping, and you usually get a bruise response because you are splitting connective tissue and fibers. You could use this tool on your quad here or an elbow when you're seated. Of course, the best way to really get it is if you're in a stretch. The thing is, with the stretch, you can't just let your back arch. You're gonna have to kind of lengthen the muscle, and then you could also break things up like that. Now, the other option you have if you're really tender and this tool's not gonna work is use this ball. And you're gonna use the ball for, if you feel the bone, just inside the bone, anywhere up or down in that region, just below the bone, and you can go anywhere up or down and kind of even around. So pretty much staying in that quadrant. And the way that you would want to get it is I'm going to go just inside that bone. You will have to shift your weight a tad so that you can feel the muscle go onto the lacrosse ball. You can move your leg to help with the release. You could go about 1 centimeter down, 1 centimeter up, find a new spot, as long as you stay tucked inside that bone. Of course, just below the bone, you can pretty much lie dead on it. Slight weight shifts will help you find, like this one for me, is much more significant. And again, you could roll 1 centimeter up or down, or even 1 centimeter side to side, and you know that you're gonna get them because you're gonna target these sore areas, and then you'll feel them melt and break apart. So remember your major hip flexors: psoas, iliacus, flexor head of adductor magnus, and your rectus femoris.